Hi, this is Dr. Antolak from theGentalDentist.com in Shelby Township, Michigan, in Macomb County. And what I want to address now is, in case of an emergency, let's say you have a child who is running and all of a sudden falls. What I want to do is talk about what you can do to take care of a problem in case it does take place. If a child's running and usually it's typically the front teeth somewhere, they fall, they hit, and the tooth comes out, we call it an emulsion. The tooth breaks out of the mouth, there's typically lots of bleeding. The most important thing you can do is find that tooth and place it directly into that socket. Okay, you can gently, it's best even if the child has saliva, just to kind of literally take off if there's dirt on it, take off the dirt, and then with the mouth, and then just place the tooth right directly back into the socket. Placing the tooth back into the socket will do a few things. It gets it back into its natural state, so that these fibers that are attached to the tooth can reattach in a quick fashion. As long as it's less than 30 minutes, it's okay to do that. If it becomes longer than that, it's still best to hold it in the mouth, or if you can get it back into the socket as soon as possible, but the likelihood for it to reattach is significantly less if you wait the longer you wait. But go to yourself, find your dentist, or you can give us a call if we're available, and our number is 586-247-3500, or go to your dentist for that purpose. If you can't get in, there is a solution. People ask what you can put it in. Well, you can put it in milk. That's a decent substitute, but the best place to store a tooth that's broken off is probably in the child's mouth. If the child's too young, and one of the parents put it in the mouth and just store it in there. It keeps it hydrated, and it keeps the chance that you can put this back in is much better. Obviously, the sooner you get to the dentist, the better it is. Typically, though, I will find that most times something happens to teeth is you either will break off a part of the tooth, part of it will be broken off, the nerve may get exposed, things like that. What we'll do is make sure you can find that portion of that tooth that's broken. If you can find that portion of the tooth that's broken and soak it in something like either water or saline water or milk, then when you come in, we can literally bond the segments together. Then when we do that, it gives us the strongest type of bond, and it also gives us the most natural appearance. Front teeth are very characteristic in the color that they are, so that's important. Another problem that can take place is if the tooth, when falling, it gets intruded into the jaw, into the bone further. So it's important with that is just to get to your dentist to find out if it's something that should be resolved right away or not. So the key is getting to the dentist as soon as you can after one of these accidents take place. At my office, I do carry a cell phone, and you can contact us immediately. And if I'm available to do it, at least I'll give you some direction and or where to go and what to do. So if there's any questions, you can call our office at 586-247-3500. Thank you, and have a blessed day.